Hello and welcome to the latest episode of the Health Wrap by the Hindu. Once again, we discuss the most important health stories of the week. Firstly, there was a fair bit we wrote on organ donation. The Supreme Court judgment on the Delhi street dogs has opened up a can of worms. We give you various positions on the ongoing debate and discuss strategies to handle the rabies crisis. There's another debate that we hosted that is very significant in the healthcare sector. Should HIV testing be made mandatory before marriage? Do remember to stay on for our expert segment where we have Dr. Deepa Hariharan, Senior Neonatologist, Surya Hospitals, Chennai. She talks about the importance of breastfeeding with particular focus on premature babies. In our reporter on call unit, Siddharth Kumar Singh, senior reporter of our Telangana bureau, dials in to tell us about reporting on the surge in Chikungunya cases in Telangana. For these stories and more, scan the QR code displayed to the left of me and it will take you to the health page of the Hindu. So Zubeda, shall we start with organ donation?
Absolutely.
August 13th, as we know, and we've also recorded that in our columns, is observed as World Organ Donation Day. And every year we talk about progress, and yet year on year the gaps still remain. India has made remarkable strides in terms of organ donation, particularly cadaveric donation, we must agree. The technology has also improved by leaps and bounds, allowing people who've had donations to live longer, much longer than they have in the past. But systemic bottlenecks and backlogs remain.
You're so right, Ramya. India has made tremendous progress when it comes to organ transplantation, with Tamil Nadu leading the way actually when it comes to cadaveric donations. But the problem remains uneven access to care. In so many parts of the country, even now, access to an organ transplant surgery is still not possible. In fact, one of our stories highlighted how heart transplants, for instance, are unevenly distributed throughout the country, which means large parts of India, especially in eastern India, do not have access to it. Another systemic bottleneck that we have highlighted through our stories is the transport issue. We need to ensure that organs reach where they are supposed to reach within that critical time period that they have. And the third issue, again, that was highlighted in one of our stories was lack of insurance for transplant patients.
Yeah, that is truly heartbreaking, because if you look at cadaveric donations, one donor can give at least 8 organs. So that's saving 8 other people who are at end stage disease. So I think it's very important to ensure equity of access, as we've discussed in our columns repeatedly, for organs, and also make it possible for people who are not from urban areas also to benefit from organ transplants. At the moment there is a big urban rural skew as well, and we will have to be addressing that. And talking about live donations, did you know that it's possible to donate part of a pancreas or also the intestines? Fecal transplant is now possible, and the possibilities are simply endless. I am sure in a few years when we are discussing this, we will be discussing far more advancements than we have today. But it is true, as you have said, that not everyone has access, and it is so important today to ensure access and increase the donor pool, for which awareness is a huge component.
Yes, absolutely. Should we move on to the other big issue that has hit the headlines this week?
Absolutely, go ahead.
Which is the Supreme Court's decision asking the Delhi government to move out all of the stray dogs on its streets.
Yeah, so what the Supreme Court actually did is that it asked the state, the government, to confine the dogs on the street, community dogs, in a location that's far off from the city, so that they do not come back onto the streets. And as we know, it has created such a maelstrom with animal rights activists and people who claim that dogs lead to rabies on both sides of the debate. But for us at the health desk, it's very important to discuss the question of rabies, because you know what, nearly 80 years after independence, we are still discussing how animals cause rabies in populations, and that essentially for me is a public health failure.
It is a public health crisis, you are right about that, and it is an especially sensitive one considering that the World Health Organization notes that children between the ages of 5 and 14 are most vulnerable to rabies infections and deaths, and it also points out that the fact that India is probably undercounting its rabies infections and deaths. So this has become a huge controversy, as you said, as to how to tackle this problem. And do you think that there should be a One Health approach here?
Absolutely. One Health approach is what is going to fix this, in my opinion, and also the considered opinion of experts who have been writing since the Supreme Court judgment. One Health is a concept that essentially tells you to look at health issues as human health, animal health and environmental health. You bring in the whole social, economic angle also into it. Equity becomes an important part of how you discuss solutions, and sequestering or secluding animals in shelters, I think may not be the only issue if you have not addressed your animal birth control problem and the issue of vaccinating the dogs. If the city or the urban local body or the rural local body is not able to do this, then a huge issue arises and the problem of rabies will continue. These dogs will continue to be reservoirs of rabies and they will continue to infect people on the streets, unassuming people who are just walking along the streets.
Absolutely. The tragedy here is that this is a completely preventable infection, both by vaccinating the animals and also by ensuring that people who are bitten or scratched or in any way come into contact with an unknown animal are given prompt vaccinations.
Yeah, this is not a debate for or against dogs, but it is a debate on how we can ensure better health facilities and also have in place a very, very robust animal birth control and vaccination program. So, from one zoonotic disease, do we go to another?
Moving from one zoonotic disease to another, this week on our Reporter on Call segment, we have with us Siddharth Kumar Singh from the Telangana Bureau to discuss the chikungunya crisis that has hit Telangana and the disparity in data between the central and state governments. Siddharth, you've been reporting on the chikungunya crisis in Telangana. Tell us what the ground situation is like now.
Yes, ma'am. So the big story which made headlines in the health sector last week in Telangana was while in the ongoing monsoon session of the parliament, a question was asked about the chikungunya cases in the country, and to which the Minister of State in the Ministry of Health and Family Welfare, Anupriya Patel, replied to the questions, giving details of all the chikungunya cases recorded across the country in the first half of this year. In that, while looking at the numbers from Telangana, I found a significant increase. According to the data presented in the parliament, it said that in 2024, the state recorded about 170 chikungunya cases, whereas in the first half of 2025, the state surpassed 1,500 cases. That caught my attention, and then so that caught my attention, and I was like, this is kind of an epidemic that the first half, with the monsoon just beginning, 1,500 cases is a lot. So then I reached out to we have an additional director who looks after seasonal diseases here in the Directorate of Public Health. While asking him the on-ground reality, he actually refuted the data given by the union government. He was like, no, the state has actually recorded only 160 odd cases. So that was kind of shocking, and he's like, no, we don't know who has given the Telangana data to the center, but that is not the reality. So then the following day, we have written the story with both the center and the state versions, claiming that there is a discrepancy in the data, and a huge discrepancy. Then a day later, the health department issued a clarification after the article, saying that the 1588 cases which the union government has revealed is actually the cases tested and not the cases which have been recorded. These are the samples which are tested. But then, while I could not get in touch with the health department again, what caught my attention is, I mean, if the union government had to say that these many samples were tested, if 1588 is true for this year, it couldn't 170 couldn't be true for the last year. You can't test 170 samples only. So that has been a talking point.
I can imagine, like you said, it's a huge discrepancy in the data. It's almost 10 times as much, right? So
Yes,
wondering like
yes.
whether this data is correct. And since the center collects data from the states, it obviously must have been Telangana that actually sent the data to the union government. Right. So that
Yes,
must be
yes.
a very interesting story to report on. Tell us what is what are the measures in place locally to handle infections of this sort in Telangana? From your ground reporting, are infections like these on the rise during the monsoon season?
Yes, yes. So last year as well, the state recorded us, pretty high numbers in across seasonal diseases. Dengue was up like 2000. I'm not sure of the exact number, but 2019 was when the cases peaked, and the post COVID the numbers went down. But last year, dengue cases went high. Chikungunya cases were also high, and this year I think because the monsoon arrived a little late, and currently with rains slashing parts of Telangana, there is a there is a chance that these diseases could hit their peak this month and the next month. And while during my reporting, I found out that the health department is actually doing a lot of things. They have started firstly they have actually prepared all the uh, primary health centers, government hospitals, not just in Hyderabad city, but also in all the 33 districts of the state, where they have asked the officials to make medicines, the medicine stocks available, and keep some more stock for a fail-safe option. And then they've also requested medical officers in the PHCs to take a special precaution on pregnant women, and if they are due for delivery in the upcoming days, they can shift them to the hospital. Because of the rains also, there might be a transportation problem in the rural area, so they've asked them that the pregnant women be shifted to the hospitals early. And apart from that, the health department has been issuing continuous monsoon advisories, in which they have pointed out all the precautions which have to be taken, the do's and don'ts, in like get out of your house during the rains only when it is necessary, clean. I mean, just make sure that your environment around your house is safe, and all that. And I think even the health minister, which is who is C. Damodar Rajan, he's also been continuously taking review meetings of with all the district collectors and the health officials regarding this thing. Apart from that, in the Hyderabad region, the Greater Hyderabad Municipal Corporation (GHMC), they have also started the door-to-door fever surveys, where they are reaching out to the houses through ASHA workers, ANMs, and their staff, just doing a survey, and then if anybody is found suspicious, they are getting the sample tested for as a precaution. And yeah, apart from that, I think what the government is telling us is that they have ambulances on standby. They have kits, and I mean sufficient kits for sample testing, and they themselves are also doing activities on. I mean, to stop mosquito breeding, like cleaning water and stagnant water cleaning, and anti-larvae operations.
So, since you was talking about anti-larva operations and the mosquito issue, so much of this also has to do with the environment, the local environment, hygiene, and sanitation, correct? So, a lot in order to prevent the spread of diseases. Tell us a little bit about that and as to what the health department wants people to do.
The director of public health, so far since the monsoon began, has issued about four advisories, which are all the same. but they are continuously advising the citizens through the media on what are the precautions to be taken. So some of the precautions they want us to do is in your house, if there is a place where there is water which is stagnant, or with where water can be stored, so you can do that. Among one of the things which has been happening for the past few years is also what the government calls Friday Dry Day. So they want us every Friday to do a dry day campaign in our own houses and surroundings, where you clean all the water which is there in your houses. So it could be empty pots or whatever, where which can be a breeding ground for mosquitoes. Apart from that, they have also, I mean, again, some basic precautions are uh, drinking boiled water, or using hand sanitizers, taking precautions while shaking hands. And these are some of the things.
Thank you, Siddharth, so much for coming in and sharing your insights on how to cover an infectious disease in a state. Thanks so much for being here. Now, Zubeda, the other debate that has surfaced recently is something that we've also looked at, which is whether HIV testing should be made mandatory before a marriage, and naturally, the status of the test revealed to the spouse is something that the High Court, the Supreme Court of India has taken note of, and Meghalaya has recently considered introducing a proposal to make HIV testing mandatory before marriage. And it is created a maelstrom, just like our rabies issue among the HIV community. It has created a maelstrom out there.
Well, I can imagine how this must be a very divisive issue, considering that we still haven't been able to beat back the stigma that is associated with HIV/AIDS even today. You also, in your very interesting parley that you had last week, you also discussed the fact that Goa had tried to bring in such a legislation but has not yet succeeded, correct?
Yeah, that's true. Goa has tried it. It has also framed a couple of laws that might, work. But the fact is that currently the HIV/AIDS law does not allow for mandatory testing without counseling or without giving information. By counseling, I mean giving information to the patient on what follows after a test and what having HIV means. And I think the question is, in the Northeast, as we heard in the parley, in the Northeast people are worried about high rates of HIV, and they are also worried that women are inordinately affected by not revealing the status of the of the spouse. So that is something that came to the fore during that parley, and it's not ended the debate by any means. It's probably given more thrust to a debate that will continue for a while at least.
So now that we are at the fag end of the month, Ramya, I have to say that this month began with a very interesting milestone that was marked, which was Breastfeeding Week, and where we talked about, and we had a number of articles that discussed the importance of breastfeeding, especially for preemies, for premature born babies, and you're going to delve a little more into that, aren't you?
Yeah, absolutely. Our guest today is Dr. Deepa Hariharan, senior neonatologist at Surya Hospital, and I'm sure she'll have a wealth of information to share.
August is the month for breastfeeding. The first week is observed as Breastfeeding Week. But I think it's not too late to talk about the importance of breastfeeding itself. And since you're a neonatologist, maybe you can share your experiences on how we have to handle preemies, premature babies as well. So let's start with the importance of breast milk itself.
Yeah, I think as you rightly said, August first week is the World Breastfeeding Week. But round the year, we have to keep celebrating, Breastfeeding Week, Breastfeeding Days. And coming to the importance of breastfeeding, I think we all know many facts about it. It is the most easily digestible food. It is custom made for every baby. It is so custom made that nowadays we say that every mother's breast milk is as unique as fingerprints. She makes such unique breast milk suited only for her baby, both in terms of nutrition and in terms of the immunity that the baby needs. We compare it to fingerprints. In addition, we know that breast milk has factors that support higher IQ, better brain, cognitive development, more psychological strength, as well as less allergies in future, asthma. And in addition, long-term benefits may even include reduced risks of cancer, both in the baby and in the mother. So these benefits of breast milk have been known for a long time. But even now, we haven't completely demystified what is the composition of breast milk, which is why there is no formula equal to breast milk. Even in the day of Google Maps and we going to the moon and so many other technological breakthroughs, we haven't found one formula which is 100% equal to breast
When we talk about ensuring that breast milk is given to children, especially the colostrum, which is the first feed,
milk.
um, it we very well know that in India it was the practice to feed the child with breast milk, and at least up until 6 months or even beyond. We know of mothers who fed their children for years, going up to 4 or 5. What led to this change over, where women found it difficult to either feed the children breast milk or thought it would be okay not to? Why did we change from a breastfeeding culture to a formula feed culture?
I think we have been going back and forth in this. Like there are some times when there was more formula usage, but then again, there is thanks to the media, a lot of hype awareness about breastfeeding. Again, breastfeeding becomes very prevalent. Again, after some time, so it has been going in cycles. But I think the main reason is not that people are not aware of the benefits of breast milk. It's mainly lot of psychological stress in mothers. Practically more than any other medical illness or more than not knowing the benefits of breast milk. And I wouldn't even say that people don't have the time for it, because even in the private sector now there is substantial maternity leave. I think there is so much of stress about how to bring up the child, and stress affects breastfeeding rates. So we need to address this more holistically, not just teaching a mother how to breastfeed. It needs a holistic approach, empowerment of the mothers, so that they are most of them, not most of them, all of them desire to breastfeed. I think every mother desires to breastfeed, but for some reason it is not happening. And some of the factors like maternal stress, lack of support systems, and rarely, okay, less time and other practical issues, these have to be addressed comprehensively.
Right. That also gives us a lot of perspective into why this, we have these cycles going back and forth. The the You also mentioned when you were talking about the time element, whether people have time or they're unable to feed. Did the fact that more women were going out to work also have some role to play in this whole shift at some point of time?
Yeah, that's absolutely true. So, because though there is maternity leave between 6 to 9 months, okay, a lot of times in the private sector, they don't avail it for various reasons. And sometimes there's a change of job, or they've been in the job for a short time. They have to return, at least work from home soon. But even work from home nowadays is 8 hours, 10 hours, 12 hours, etc. So, time is an important factor with more and more working women. And also, they're delivering babies at a little later age when they are in a more, what should I say, more responsible position in their job. So, taking leave, being away from the job becomes more challenging. The more senior the position, the more difficult it becomes to take some time off. So, time is a very, very important factor, and breastfeeding is a 24-hour job. If you want to exclusively breastfeed for 6 months, it is very difficult to do it. Of course, it's not impossible, but it's very difficult to do it while you're also on a job. Because every 2 to 3 hours when you feed on demand, that's when the baby is most satisfied with breastfeeding. And that's when the mother's supply of breast milk keeps coming in. Rather than pumping at infrequent intervals while at work, frequently pumping or frequently feeding on demand. These two principles are the important principles of successful breastfeeding, and time is a very important factor, especially for working women.
Right. So, if we move on to, the particular case of preemies, so there are challenges when a child is born premature. The child, does not latch on easily, does not suckle, maybe. There are issues, maybe the child will have to be on support. So, what are the strategies that you would use in a hospital to help these babies, and what can be done at home?
Yeah. So premature babies, as you rightly said, they find the successful breastfeeding, exclusive breastfeeding is most difficult for this subset of patients. But we increasingly see it in term babies too. Both, but we see it. But in premature babies, it's also related to the baby factors related to the baby, not just the mother, environment, family, etc. Lot of premature babies, the first problem is they are separated from the mother in the first few days to weeks of life because they are in the NICU. Mother is in the same or different hospital. So she's not able to handle the baby, touch and talk to the baby in the first few days of life, which is when the maximum impact of breastfeeding, successful breastfeeding, maximum impact is in the first few days. If started at that time, it is more successful much longer. So that's one big challenge. The second thing is lot of these babies, especially with the very premature babies, less than 30 weeks, less than 1.5 kilo birth weight, they are on either ventilator or they have oxygen tubes, CPAP, they have prongs on their nose, and they have tubes to which they have to feed. This impairs the maternal infant bonding, her ability to hold the baby, as well as these babies are too immature to actually suck. Believe it or not, sucking and swallowing, which we think is nothing, but it happens only at 34 to 35 weeks of gestation. A baby learning to suck, swallow, and breathe at the same time without choking, without having breathing difficulties during a feed. Babies before this have to be taught, they have to be taught this learning skill in various methods, and they learn it in various different ways. So for premature babies, because of these physiologic, biologic difficulties and the practical problems in the mother and baby being separated, we encourage strongly expressed breast milk. Okay, the mother should express the milk, and it can be kept 4 to 6 hours in room temperature. The milk should be expressed in sterile containers, safely transported to the NICU at frequent intervals, and the expressed breast milk is fed to the baby in the initial few weeks or days by a nasogastric tube, that is, by a tube instilled into the stomach. Once the baby learns to suck, swallow, then we gradually transition to Palade and then to direct breastfeeds. So even for premature babies, even with the challenges they face in terms of not being able to take by mouth, many parents, we have been able to give exclusive breastfeeds by motivating the mothers and taking care of these practical issues.
Right. So, there you yourself mentioned that there are several instances now, particularly where both in terms of the mother's inability to express breast milk, there are factors that influence that as well, and the child's ability to suckle properly. In these cases, when the mother is not able to feed the baby, there, a lot of postpartum depression also adds to it. What would be your advice to such mothers, because the guilt of not being able to feed the baby is also there, because the world is talking about breast milk and how it's very important and it's crucial.
Yeah.
But how do you advise these mothers to, because they are unable to, are there
Yeah.
strategies to cope with this?
Yeah, I think this is a wonderful question because whenever the media, social media, everywhere it is projected that breast is best. But the way it is projected, sometimes I feel rather than a healthy feeding choice, it is projected as a moral imperative or a moral responsibility of the mother. So much so that anybody who cannot breastfeed partly or exclusively feels very guilty about it. It's a healthy feeding choice, but it is not they shouldn't feel it is immoral, or that they are not doing the best thing for their baby when they are not able to give exclusive breastfeed. In such cases, a lot of support should be given to the mother, because even recently I had an instance where a mother was going into postpartum depression, as you said, because all her other friends on WhatsApp, not all, many of them were constantly posting how they are able to exclusively breastfeed the baby. And so she would avoid meeting anybody because of this. Because they would say they are giving breastfeed, she is giving a few formula feeds a day. And that itself was causing a lot of depression for her. And in fact, she said, Doctor, when I come to you, I feel better. At least you don't make me feel guilty about not being able to breastfeed. And I know you won't make me feel guilty. So they come with that much of, they expect that much of support from the doctor. From the doctor, not just teaching them how to breastfeed, better latching on techniques, how to store the breast milk, etc. In case they are not able to do it completely or partially, the mother is in such a devastated state nowadays, especially because of pressure from social media, etc., that she needs a lot of psychological support. We'll have to tell her you're doing the best thing for your baby. Do whatever you can. Every mother, every baby is different. Don't compare yourself with other parents. And if you don't get too stressed, that itself may be somewhat more conducive to better breastfeeding. So, a lot of support is needed for this. And this is one thing I feel nobody talks about this. Everybody talks about the benefits of breastfeeding, how to give breastfeed, how long to give, etc. But this issue, what in case she's not able to do it, how to support them, any discussion about this factor is generally avoided, due to which these mothers don't get any support. And at least 20% of mothers will not be able to exclusively breastfeed in various parts. So, this is a very, very important topic, and I'm so happy you brought it up. These mothers need a lot of support. They shouldn't feel guilty. We are very kind to the mothers by advocating breastfeeding, but we should also be kind to the mother in case she is not able to give exclusive breastfeeds for some reason. Of course, we should support them, encourage them to breastfeed, but not make them feel guilty, and give them enough psychological moral support.
Lovely. So I think with this, we have a nice, short and snappy overview of breastfeeding itself. Thank you so much, Dr. Deepa, for coming on our show despite your travels. And I'm sure our readers have a lot, our viewers have a lot to gain from this short interview. Thank you again.
Thank you for doing this useful session.
It's a fun fact, yes, but it's also very inspiring in terms of what one man can do and of the achievements that science has managed in many years now. World War II veteran and Korean War veteran Orville Allen, he passed away last year, and as his last act, his liver was donated to a woman who was 72 years and waiting for an organ. So, not only was he able to give the gift of life as his last act after death, but this also makes Orville the oldest known donor in America and possibly the world.
That's an inspiring fact.
For these stories and more, scan the QR code displayed to the left of me and it will take you to the health page of the Hindu.